Flow Connect has made a really big impact on my life in a good way. Before coming to Flow, I was always in my room. I was depressed. I had a lot going on at the time. I just felt like I didn't need to go to school. School wasn't important. And then coming to Flow just really made me realise that school is important and you can actually get a lot out of it. And I didn't really see that at the mainstream schools.
How has Flow Connect helped you?
Helped me with my attendance.
Yeah.
And coming back to school.
Yep.
And confidence.
Yeah.
Yeah.
So 12 months ago when you walked in the door of Flow Connect, could you do anything like this?
No.
No, why not?
Shy.
You were very shy, weren't you? How has Flow Connect helped you achieve?
Like come back to school.
Yeah. What school are you going to?
Chafee.
Yeah. And how's that helped? So what are you doing to get to Chafee?
Transitioning.
Yeah.
And going to Chafee on Fridays.
Yeah.
Do you tell your friends about Flow Connect?
Mm-hmm.
How would you describe it?
It's really good if you're having trouble with school, and that you can come here and they'll help you get back into school.
Being here, I've got 3 jobs. I'm a part of the Western Bulldogs leadership project that my home group teacher helped me fill out an application for. Flow Connect has given me a light to my tunnel that I didn't have a light in to start off with.
So it's a joint initiative that's brought together 3 organisations locally, so Mallee Accommodation and Support Program, the Department of Health and Human Services and Sunraysia Community Health. We have come together to provide some health assistance within residential care in the out-of-home care space.
I've been a residential support worker with MASP for 4 years now. The role involves day-to-day care of teenagers ranging from currently 15 to 16 years old. The out-of-home care health assessment program, we strive to get all our young people that come into care to annual health, dental, audiological and optical assessments, and historically we've really struggled to have them engage with these health professionals, so the Sunraysia Community Healthcare coordinators really help us in that regards, even just building trust and relationships with their young people and getting them into the door of these health professionals. Because of the health assessment program, we've seen some fairly significant changes in our young people, just in regards to their self-awareness around health. As residential support workers, we're not health professionals. We can't provide them with all the information they need in regards to their health. So the healthcare coordinators provided that knowledge, and it's really benefited the young people and even the carers.
For our kinder, the benefits of Smiles to Miles is we really have a good understanding of that. The earlier we get in and the earlier we can embed these health programs into education, the better chance these children have for longer term. Smiles to Miles also has lots of fun components, so the children enjoy it. A lot of it's about education as well to the families and the kinder community. We also share a lot about the dental services at Sunraysia Community Health and letting parents know that they're free services. It just becomes part of the children's understanding is health and dental are linked together in line with healthy eating. So we can do lots of education, but it's the messages that the children are learning and taking home to their families that we think make the big difference.
The Mildura Suicide Prevention Trial is one of 12 that are happening at the moment across Victoria. These are really holistic trials that look across many aspects of a community towards preventing deaths by suicide, attempts of suicide. Where we're heading is we've got 2.5 years of work to do here in Mildura. We want to look at the most impact that we can make across all of those aspects of the Black Dog framework that we can in our community in that time. That includes community voice. We've already got 12 local people who've come forward and are doing some training to be able to really help us decide what this trial does and who it should be targeting and where we go with it. So that is fantastic. They will really be the heart of where we go with the trial.
The vision for Hands Up Mallee is a connected community where families matter and children thrive. And that's what we really exist to do. So it's about working differently, working with the service sector, working with the community and working with the business sector as well to make that a reality. The community told us is that early intervention and prevention was important and that working with children, families and young people was their priority. The next 12 months for Hands Up Mallee is really about action. So moving to look at how we can change some of those population level indicators. Prioritising the first 1,000 days so children get the services they need when they need them and families feel supported. And getting community involved in people supporting people.
The Community Leaders Table is a group of people from service industry, business and community members that have come together to try and get new outcomes for our local community. I became involved with the Community Leaders Table through my daughter who was doing work experience with Hands Up Mallee, and once we saw the statistics of how our region was doing, I felt that I needed to get involved to see if we can change those outcomes. Some of the benefits for Hands Up Mallee in our community are seeing the statistics that are in the negative at the moment with lots of different issues being turned around so we can actually re-engage our community to empower them and to bring together a feeling of connectedness and giving us a new and positive outlook for our future.
Mallee Children Youth Area Partnerships is about working with our community to better understand how our service sector and people of our community can come together to address complex social issues. An example of this work is developing an understanding and responding to the impact of high rates of teenage pregnancy within our community.
Sunraysia Community Health now offers an unplanned pregnancy counselling option service. This is a new service that targets young women but is open to women of any age who have an unintended pregnancy. For years, women haven't had many places to go for ethical, unbiased information and support. Our service offers help to work through your options and help make an informed decision.
The state government has funded the rollout of the Strengthening Hospital Responses to Family Violence project here at the base hospital in Mildura to provide a whole of hospital approach to the issue. Through this initiative, health services are being supported to better improve their identification and responses to family violence and refer patients experiencing family violence to the appropriate support services in our community. The Strengthening Hospital Responses to Family Violence program has been developed based on the understanding that gender inequality is at the core of the problem that is family violence. We have over 800 staff here at the hospital, all of whom will be trained in family violence awareness, and this will have a very deep reach into our township and will raise the consciousness of the issue in our community significantly.
We want our staff to know how to ask these questions sensitively and to be able to connect the victims to the support services available within our community.
I work for Mildura and I'm a women's caseworker, so I work with intensive women. My job includes me to work indoors, outdoors, also in courtrooms. My main job is to keep the women out of the justice system. I enjoy every bit of that kind of work. As an Aboriginal woman, I find it very hard for us to be where we should be in life. Just on a daily basis, it just makes it harder to, I think, just to be Indigenous without the challenges that we face. So in saying that though, my main motivation would have to be my daughters. And they motivate me every day to get up and do better every day, want more in life, and to make better choices. If they can see that I've done it and I'm a local, then that will give them the confidence boost that they need to get to where they need to go. I'm a very determined person. If I get knocked back, I'll come at you 10 times harder. It's been very challenging for me to find full-time employment up until now.
The community spirit and an amazing landscape was a key factor in moving my family to Mildura. Because of my new job, now I have a more confidence in this area and raise my family in this beautiful place, and I can call it now as my second home. Major projects like Mildura Future Ready are so important to our community to help people find jobs, improve our local economy, have a greater emphasis on education and training, and also enhance community well-being. We all have a big part to play in bringing these projects to the area and helping transform our region to help the disadvantaged. Continued support for large-scale investment from state and federal government to help future-proof our community for years to come is something I'm very passionate about. I know how much it would mean to everyone in the community.